Hi, my name is Jenna Cotton, and this is my neuromuscular health assessment video. Knock, knock, knock. Come in. Hi, my name is Jenna. I'm going to be your student nurse today. I'm going to be performing a neuromuscular assessment on you. Can you tell me your name and date of birth?
Riley Vaughn, date of birth 10/18/2001.
Awesome. I'm going to wash my hands, close the curtain for privacy, and raise your bed to working height. Are you having any joint stiffness?
No.
Do you use any assistive devices like a cane or a walker?
No.
Have you been in any traumatic accidents, like car crashes or anything like that?
No.
Okay. Can you tell me your name?
Riley Vaughn.
Do you know where you're at?
At home.
Do you know what time it is?
8:30.
And do you know what situation you're in?
I'm helping my roommate with homework.
Awesome. Patient is clean, hygiene is normal, behavior is calm and cooperative, and her speech is clear and unslurred. I'm now assessing cranial nerve 8. I can tell that cranial nerve 8 is working and intact because she's able to respond to my questions during conversation with no difficulty. She's answering my questions appropriately, which means that she's able to hear me accordingly. I'm now assessing her cranial nerves 3, 4, and 6, which are her ocular motor, trochlear, and abysmus. Her eyes are symmetrical with no abnormal fissures or anything like that. Can you close your eyes for me? Her eyelids approximate. I'm going to measure your pupil size here. It looks like she's about a 7. I'm going to have you look at this light here. You can look straight ahead. And her pupils went to about a 3. I'm going to have you follow the pen light with just your eyes and not your head. Her eyes move smoothly when tracking with no nystagmus. I'm gonna have you look past me at like the corner where the ceiling and the wall meet. Now look back at the pen light. There's good accommodation. I can tell that her cranial nerves 3, 4, and 6 are intact because her pupils are equal and reactive. And her eyes move smoothly with no strabismus, and she also had no problem tracking with the 6 cardinal positions. I'm now testing cranial nerve 7. I'm going to have you copy my facial expressions. I'm going to have you smile and frown. And I'm going to have you close your eyes really tight and open them really big and raise your eyebrows really high. And now I'm going to have you show your teeth. And I'm going to have you puff your cheeks. I'm going to press your cheeks in. Awesome. I can tell that her cranial nerve 7 is intact, because she's able to follow my facial expressions the same as me. I'm now going to be assessing cranial nerves 9 and 10, which are glossopharyngeal and vagus. I'm going to look in your mouth with my pen light. Can you open your mouth and say ah? I can tell that nerves 9 and 10 are intact because the uvula and the soft palate rose midline and the tonsils moved forward. I'm now assessing cranial nerve 12, which is the hypoglossal. Can you stick your tongue out for me? I can tell that the hypoglossal nerve is intact because there's no tremors and the tongue is midline. I'm now going to be doing the cranial nerve 11, which is the spinal accessory. I'm going to have you push your head against my hand, looking this way. Good. And the other way. And I'm now going to have you shrug your shoulders against my hands. Good. I can tell that this nerve is intact because the patient is able to move against my tolerance and the strength is symmetrical. Going to assess her sensory perception, I'm going to have you close your eyes, and I'm using a key because I don't have a tongue depressor, so the fob side is the dull side, and the key side is the sharp side. Close your eyes for me, and let me know when you feel sharp or dull.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Patient was able to assess correctly the dullness and sharpness on all 4 extremities. Now I'm going to assess your finger coordination. I'm going to have you go like this. You can go ahead and close your eyes and do that. Patient's finger coordination is normal. I'm now going to assess your stregnosis. Can you close your eyes and hold out your hands for me? And you can feel that. Can you tell me what that is?
The key.
Awesome. Patient shows no stregnosis when placing key in the hands. I'm now assessing the patient's balance with the Romberg's test. I'm going to have you put your feet together and close your eyes. You can just stand there. Okay, you can open your eyes. Patient is negative for Romberg's test. The patient shows good balance. I'm now going to test your grip strength. Can you squeeze my fingers with both of your hands? Awesome. Patient's grip strength is strong and equal bilaterally. I'm going to have you push down on my hands. Awesome. And then push up. Patient's strength is equal bilaterally, 5+ on the upper extremities. I'm going to do it with your feet now. And you can put your hand here if you need to balance yourself. Push up. Good. And push down. Good. Push up. Good. And push down. Patient's lower extremities show 5+ with strength bilaterally. Now I'm going to check the range of motion of the patient's neck, and I'm going to have you follow along with me for flexion, chin to chest, extension, chin up to the sky, lateral bending. I'm going to have you do your ear to shoulder, and the other way, and rotation, look to your left, look to your right. Patient has full range of motion in the neck. I'm now going to be checking the patient's range of motion in her ankles and feet. I'm going to have you do plantar flexion, point your toes down, and the other foot. I'm now going to have you do dorsiflexion, point your toes up to the sky, other foot. Now I'm going to have you do inversion, which you roll your sole in, and the other foot. And eversion, roll your foot out, and out. Patient has full range of motion in her feet and ankles. I'm now going to assess the patient's gait, and you can walk to the couch and then walk back to me. There are no abnormal findings with the patient's gait. The gait is smooth and effortless. Okay, I'm scoring her on the Braden, Morse, and Glasgow scale. I have the scoring sheets here on my phone. For the Glasgow Coma scale, she scores a 15, eye opening is a 4, motor response is a 6, verbal response is 5. For the Morse Fall scale, she scores a 0, so she has no risks, so she would just need basic nursing care. And the Braden scale, she scores an 18, so she has no risk for pressure sores. Thank you for allowing me to assess your neuromuscular system. I'm going to wash my hands, raise your bed to a safe height, put the bed rails up, give you your call light, and close the curtain for privacy.